Greetings to all my teachers and friends. The opposition pointed out about the doctor's oath. The proposition does accept the fact that maybe doctors do not mean any harm to anyone at all, but what they did are procedures that did no good to Ashley. These procedures are not necessary. Thus, questions the intentions of the doctors. Why would you do an unnecessary procedure on a child? Would you let your child go through an unnecessary procedure if you really care for your child? Maybe the opposition could ask themselves this before saying how Ashley's parents care for her so much. The opposition pointed out the use of anesthetics on a child. The risk of temporary or nerve damage varies. Seeing that Ashley has already suffered enough, would you still have her undergo the risk of overdosing in anesthesia just to eliminate pain? The proposition has left the opposition some questions for them to answer on this debate. However, they have not answered these questions very well since they have not given the whole truth. The proposition have first asked the question, is attenuating growth for the best interest of a child? The proposition has stated reasons why it is not for the best interest of a child. There is a risk for deep vein thrombosis, which is a syndrome of blood clot in a vein. Nausea, headache, weight gain, and mild hypertension were reported to be side effects for taking too much estrogen. Slower lipid metabolism, formation of gallstones in the gallbladder, risk of cervical cancer, breast cancer, heart attack, and stroke are the major side effects of this treatment. The small child might have stigma because of her unnaturally small size when she can finally realize that she is smaller than others of her same age. Second, are the doctors really doing the good for the child or are they just in it for fame? The proposition stand is that the treatment is not the best option for treating children with profound disability. It brings them discomfort because of the pain they will be going through during the duration of the treatment. It gives them risks, which are mentioned above, that are not worth for the reasons that doctors are pointing out of attenuating growth's benefits. Are the parents just thinking of their own personal interests and not really the child's overall good health? The proposition is not blaming Ashley's parents for wanting to have a better life for Ashley. However, the way they chose to treat Ashley to make her life better is not really making their lives easier. They have agreed to unnecessary medical procedures that Ashley do not need. The proposition says that these are unnecessary procedures because Ashley does not need the hysterectomy, the mastectomy, and the stopping of bone growth. She has a profound disability on which these procedures do not cure her disease. Estrogen therapy was given to her without any medical reason. It is just because her parents want her to stop growing. She may face unknown disease in the long term due to this untested hormonal procedure. Ashley's parents did benefit from the procedure. They could carry her around, be with her family, but this benefit does not equate the side effects it has on Ashley. In short, the parents' benefits are not Ashley's benefits. Legally, the court is questioning the procedures that were used on Ashley because they were abusive to her. It is abusive because removal of her healthy organs is harmful to her. It is Ashley's right to live with complete healthy organs, and her doctors just removed her healthy organs for no medical reason at all. Therefore, estrogen therapy was only for social reasons, and the procedures done to Ashley are just to correct the hormonal procedure. It was a social benefit and not to cure her. This is why the proposition believes that attenuating growth is not necessary. The proposition still believes that long-term care facilities for children with profound disability is the best option for parents who cannot care for their children anymore. Long-term care facilities are trained for these situations. They are more experienced in caring for these children with special needs. If the parents were still uncomfortable with a long-term facility, assisted living facility would be their option. This is when a trained and professional person would help the parents care for their child under the roof of their home. This is to make the child be more comfortable and that all the activities of the child will be monitored by a skilled professional. Money for these facilities is not a problem, since parents are also willing to spend money for the estrogen therapy. Why not they just put this money in caring for their child more than spending it on unnecessary procedures? This is the other option that Dr. Chef pointed out for Ashley's parents, and not just attenuating growth. Attenuating growth for profound disability should not be allowed because it is not necessary.